Emotional and Behavioral Disorders, abbreviated as EBD. Subscribe, like, and share to receive notifications of new videos. During this presentation, we will cover the definition, characteristics, identification, prevalence, causes, educational considerations, and transition for EBD. Starting with the definition. Emotional behavioral disorders are an inability to learn not due to intellectual, sensory, or health factors, an inability to maintain satisfactory relationships, inappropriate behaviors or feelings, a pervasive mood of depression or unhappiness, and physical symptoms or fears. The behavior is chronic, unacceptable, and extreme. Just remember Q. C is for chronic, U is for unacceptable, and E is for extreme. A few characteristics. When looking at the intelligence quotient, the average human has an intelligence score of 100. Moving over to the right, you will see a score of 115. This score is one standard deviation, or in terms of this IQ chart, 15 points higher than average. So this person, if they had a score of 115, would have a high average IQ. If we go over to the left-hand side, the score is 85, which is 15 points lower than the average score of 100. Meaning if this person scored an 85, they have a low average IQ score. The important thing to remember is that scores from 85 through 115 are all considered an average IQ score. When we're looking at students who have EBD, they typically lie in the low to low average range, which is a score of about 90 or below. Some of the cognitive characteristics are what was just mentioned, of typically having an IQ in the range of 90 or less. You often have other disabilities, such as a learning disability, which happens about more than 50% of the time, attention deficit hyperactivity disorder, and you may also have depression. Research has shown a relationship between academic and social behaviors. When we move on to internalizing behaviors, these are behaviors that are within the person and they're not seen on the outside. These behaviors include anxiety, depression, isolating behaviors, school avoidance, obsessive compulsive disorder, often called OCD, post-traumatic stress disorder, often called PTSD, psychosis such as schizophrenia, continued sadness, and irritability. The opposite of internalizing behaviors are externalizing behaviors, and these are behaviors that are portrayed outside of the body. For example, socialized delinquency, such as gang involvement or constantly being absent from school, which is truancy, or they're constantly looking for ways to violate any rules that have been put in place. There's also frequent angry outbursts, possibly aggression towards people or animals, property destruction or theft, self-injurious behavior, such as cutting. There can be mood swings, repeated actions or rituals. They could be easily startled or irritable, possibly hostile. They may act out nightmares or have eating disorders. When getting a diagnosis of an emotional or behavioral disorder, the diagnosis will depend on whether the behaviors are internal or external. Possible internal conditions include anxiety, depression, and schizophrenia. If the behaviors are more external, the diagnosis could include oppositional defiant disorder, conduct disorder, reactive attachment disorder, bipolar disorder, post-traumatic stress disorder, and eating disorders. Unfortunately, suicide is a leading cause of death for those ages 15 to 24. So how do we identify those with emotional behavioral disturbance? A non-discriminatory evaluation is often used. This evaluation includes an observation, screening, pre-referral, then a referral, followed by the non-discriminatory evaluation procedures, and ending with a determination. So how often does EBD occur? Approximately 6 to 10% of school-age children have been diagnosed with EBD. The majority of students are diagnosed with a behavioral disorder as they show externalizing behaviors more often than internalizing behaviors. Boys tend to outnumber girls 5 to 1 in showing externalized behaviors. It's possible that girls would be diagnosed more often with EBD if they showed more externalizing behaviors. But since it's difficult to see internalized behaviors, they're diagnosed less often than boys. 1/2 to 3/4 of children in foster care have also been diagnosed with EBD. And children who are homeless experience EBD 3 to 4 times more often. What can cause EBD? Some risk factors include genetics. There are many brain disorders that cluster within families, showing a genetic disposition. Brain damage is also another cause. There may be injury or infection to the brain. It could be poor nutrition or exposure to toxins such as lead. And another set of risk factors includes child maltreatment. Malnutrition, aggression, neglect, as well as physical and emotional abuse can all cause EBD. Here are some educational considerations. When looking at possible school factors, students often do not receive research-based interventions in reading, which can cause frustration and early failure. There's a 58.6% dropout rate for those diagnosed with EBD. 2/3 of teachers are not certified to work with EBD. And teachers working with students with EBD experience burnout and job stress more often than other teachers. So the objective when working with students who have EBD is to control misbehavior and to teach academic and social skills. Here are a few tips for teaching well. There's positive reinforcement, response cost, proximity control, attention to compliance. You can always ignore the problem behavior. There can be group consequences, self-management, contracts, and service learning. Other strategies that work well include continuous assessment and progress monitoring, provision for practice of new skills, treatment matched to the problem, multi-component treatment, programming for transfer and maintenance, and commitment to sustained intervention. When looking at discipline, you may want to focus on a zero-tolerance policy. This allows students to know that the expectation is appropriate behaviors at all times. A functional behavioral assessment, or an FBA, can be added to the Individualized Education Plan, or the IEP, for target-specific behaviors. You could also use a positive behavioral intervention plan or a positive behavioral intervention and support plan school-wide. There's also interim alternative education settings where the child may need to be placed in a different learning environment until the behavior improves. Moving on to transition. When addressing transition within the IEP, it's important to place the student in the right environment. Depending on the severity and the type of EBD, the student may need to be placed in a regular school class with their non-disabled peers. You may have a consultant teacher who can provide individualized work or behavior management, There's also smaller settings with less distractions and less students, such as resource rooms or self-contained classes. You could also introduce work-study programs where the students are able to learn more vocational skills outside of school. And of course, there's special private schools, alternative schools, and there's private or public residential schools for the more severe cases. The main goal of transition when addressing the IEP is to assist students to become as independent as possible. Students who have EBD may have difficulty with programs designed at the secondary level. They may also have difficulty with employment due to academic skills or behavior skills having deficits. They could also require interventions throughout life, such as counseling. They may need medication, or they may need to see a psychiatrist. And there can also be complicated family relationships depending on the severity of the EBD or the type. Thank you for watching this presentation on emotional behavioral disorders.